Hi, welcome to Wellness Wednesdays. This week we continue going where others fear to tread and we're going to talk about breasts. Here's what I made earlier. In particular, we'd like to talk about breast lumps. Everybody's worst nightmare. Ladies are petrified, quite rightly, of finding breast lumps. So I thought I'd demystify breast lumps a little bit and give you some information on what things to look for. So, ladies, first things first, you really do need to get used to what your own breasts feel like. Get used to examining yourself, put it in your diaries and do it once a month. Probably best a week after your period because the fluctuations in your hormones leading up to your period can often lead to lumps forming. And so some lumps are actually normal and part and parcel of your cycle. So best to pick a date, probably a week after your period, and get used to examining your own breasts on that day, including taking note what they feel like and what is normal to you. And if you do that religiously every single month, when something does change, you will be best placed to notice it. There are lots of videos on how you can manage and examine breasts that you can find on YouTube, so I won't cover that. However, safe to say that some lumps, a lot of lumps actually, are absolutely harmless. You will notice them quite often. Some ladies have what are called lumpy breasts in the trade. Some ladies do generate quite a lot of lumps or fibrocystic adenomas or fibroadenomas, and these are little gristly lumps that some ladies form all the time. Some ladies also generate a lot of cysts. It's just part and parcel of their genetics. But some lumps are cancerous, and those are the ones that obviously we don't want to miss, which is why whenever anybody finds anything that is not normal for them, then we get referred straight in and get you examined and get a mammogram to see exactly what's going on. Luckily, we have a good screening program in the UK, this mammogram screening, which is not pleasant, I know. It's going getting your breast jammed between two X-ray plates so that we can have a good look at your breast tissue, but it works incredibly well and it does have a very high success rate for spotting early cancers. So don't miss your mammogram if you've got one coming up. What to look for in your breasts. Now, breasts change with age and change with having children. However, some things shouldn't be happening. So if you start to find a hard lump that is almost like a stone in your breast, that is not normal. If you find a lump that is irregular and craggy like a lump of coal, that is not normal either. If you start to get nipple changes where your nipple is a different shape, size, or retracts in when it never has done before, get that checked out. If you start to get an abnormal discharge from your nipple or even blood from your nipple, then that is not normal either. Get that checked. Eczema around your nipple, that is often something that needs to be looked into more carefully. So if you've got eczema around a nipple and you've never had it before, get that checked. And changes in shape of your breast, particularly on one side compared to the other side, get that checked too. Pain in your breast tends not to be cancerous, which is quite nice because a lot of people get breast pain and they get worried about that. However, if you are at all concerned about any symptoms at all in your breast, go and get checked out. There are risk factors for breast cancer. What risk factors would those be? First of all, age. Age is a risk factor for everything. The older you get, the more chance you've got of getting something. Smoking, obviously. Vaping will probably be the same. Alcohol, lack of exercise, obesity, and a big one is family history. So if you've got a family history of breast cancer, be sure to really double check your breasts on the regular and make sure that if anything does change, you alert your clinician as soon as possible. Anyway, all for now. See you next week.
Call the one you know, Halo Physio.